Thank you all for listening in. Today, I am joined by Dr. Hannah Murphy Buck, who is the Assistant Professor in Organizational Systems and Adult Health Department at the University of Maryland, Baltimore School of Nursing. She's also the Director of Restorative Practices and the Co-Director of the BSN program at the University of Maryland, Baltimore School of Nursing. Welcome, Hannah. Thank you so much for coming on the MNRC Connection. We are delighted to have you.
It's so awesome to be here on this beautiful spring day.
Yep. Fantastic. So I always like to introduce my friends here on this podcast. And so in addition to her many roles there at the University of Maryland, Baltimore School of Nursing, she has established clinical, teaching, and research expertise in the care of vulnerable populations receiving palliative care. In her work with students and patients, Hannah seeks opportunities to build a more just and equitable healthcare system where people, rather than profits, are the driving motivation for excellence in clinical care. The Restorative Practices program at University of Maryland School of Nursing has grown under Hannah's leadership, and in the past 5 years, the team has embedded restorative practices across the entry to practice curriculum, engaged faculty and staff at all levels of the organization, and started a student leadership program. Hannah uses her skills as a restorative justice facilitator and program director to build an inclusive community that helps members create a sense of belonging and support, and where conflict and harm can be managed in reparative ways, seeking to collectively move in a direction of social, racial, economic, individual, and institutional healing. Wow. What an intro for you. This is so exciting. I'm so excited to get started today. How are you doing today, Hannah?
I'm doing really, really well. I actually just got off a Zoom call with my restorative practice student leaders. So I was so pleased when this got scheduled at a time that I was just going to be coming straight out of time with students, because that's what really, lights my fire around all of this and helps me to feel like this work is immediately making a difference in people's lives.
Yeah. Yes, absolutely. And now you and I have known each other for a short time, but in that time, I have grown to know more intimately your passion for this topic today. So, and through your work, you have actually won some awards, haven't you? So you've received, from what I know, and I hope I get this right, the MNA's Outstanding Pathfinder Award in this because of this work that you're doing, and an Emerging Leader Award. Is that right?
Yeah. So the Emerging Leader Award is an award that's given to a number, I think it's like 25 folks who are members of the Hospice and Palliative Care Nurses Association.
Gotcha. Yeah.
And so that award is specific to the work that I'm doing around palliative care, and particularly palliative care education.
Gotcha.
So is not directly related to the restorative practices, but I will say that I think the core values that draw me to restorative practice are the same core values that draw me to palliative care as my clinical specialty. And so I see them very much as aligned in my own personal life.
Yeah. No, I can see that for sure.
Yeah.
I love that. I say with those and your intro, we can safely say that you are one of the pretty significant leaders in this space. So excited to have you speaking today with us and with our audience. So I think the first question for our listeners who may not be familiar with this topic, and as you know, I was not familiar. I think when we first had a conversation with us, and you were so good about explaining it to me, can you tell us and our listeners what is restorative justice?
Absolutely. So I'd love to slightly change the question, if that's okay.
Yes, please.
And I want to broaden it slightly to address what are restorative practices, because restorative justice is a part of that, but it is not all of it. So restorative practices is really, the way I think about it is sort of a mindset. And
Mm.
this mindset is a mindset that deeply aligns with the values and mindset and work of nursing. It is a
Yes.
mindset that puts human beings first and
Hmm.
looks at the importance of our interrelationship with one another. And so it's a mindset that values respect, that values equity, and that
Mm.
values community,
Right.
and thinks about the ways in which we are in relationship with one another, or in community with one another, and how that then builds and sustains us as human beings. And so when we talk about the restorative, the work of restorative practices or a restorative approach, even,
Hmm.
we're thinking about this sort of communal approach that when we're building community, we're building a space where we can work to prevent harm interpersonally, organizationally, and even societally.
Hmm.
And that because we are human, we have to admit that harm is going to occur.
Right.
But when we are approaching life and relationship from this restorative approach, we're initially preventing, but we're also creating structures that allow us to respond to harm in a way where healing and social support and active accountability can be at the core of our response.
Right.
The
Okay.
way that we're doing it now in US American culture is when we harm each other, we have a punitive response,
Hmm. Okay.
right?
Yeah.
And so think
Right.
about, for example, the criminal justice system. When someone commits a crime, they're going to be punished, right? If they're
Right.
convicted. And that punishment generally includes separation from community.
Hmm.
So someone goes to jail or prison. They are separated from their family. They're separated from their community. And we know that separation increases, sometimes exponentially, the harm that has occurred.
Hmm.
And in our criminal justice system, as an example, that separation also does not take into consideration the actual harm that happened as a result of the crime, right? Or
Right.
the mitigating circumstances that led to the need for the crime to happen, right? And I know that those words might be challenging for some of us to think about, but generally, I think human beings are good and aren't out there creating or committing crimes because they're trying to hurt people or whatnot, but they're committing crimes because there's needs that aren't met, right?
Sure. Yeah. Yeah.
And
I
getting
see.
needs met can, in some situations, cause harm to others. So
Hmm.
what I'm thinking about with this restorative approach is how do we change that mindset? And I've given the example of the criminal justice system, but let's move that back over to nursing. Okay, so
Hmm.
we talk a lot in nursing about harm and error and the ways in which the work and practice of medicine can impact patients not in the way that we intend, but in
Right.
harmful ways, right? And so I'm doing a lot of thinking right now about the ways in which restorative approaches already exist in nursing, right? So
That's right.
one of
Yeah.
the examples you and I have talked extensively about even is just culture and sort of that
Right.
movement of just culture in hospitals to look at harm from a systems perspective and think about
Right.
how do we build systems where our intended outcomes are the outcomes that we achieve.
Right.
And in fact, sort of the underlying philosophy of just culture is one and the same. as what I'm talking about, because
Okay.
we're thinking about how do we work together in ways that build our trust for one another. Because anytime we're talking about teamwork, you can't have teamwork without some element of deep trust, right?
Right.
That
That's right.
I'm going to
Hmm.
show up for you and you're going to show up for me when the going gets rough on the nursing unit, because we know it's going to, right?
Right.
And
Absolutely.
that when I make a medication error, that I'm going to be actively accountable to that error, but that the error didn't occur simply because of me. But
Hmm.
the other 500 human beings and computers and robots and all the different technology that
Right.
we have now was also involved. So where in the system can we
Right.
tweak the system so that we're getting closer to that intended outcome
Right.
without further damaging the humans in that system as we're getting to that place?
Right. Okay. Yeah. And that's, I think, what I'm most familiar with, and
Hmm.
you and I've talked about, is that just culture, and
Hmm.
that's something that is in our institutions here in
Sure.
Maryland, and I think we are familiar with.
Hmm.
And before we because and that I have so many questions related to that and how they're connected and all that, but I want our listeners to know, like, where, and then I also want to talk about why it's so important in nursing, but where did this come from? And you mentioned a little bit the criminal justice
Hmm. Hmm.
system, but can you shed a little light on, like, the history of this movement? Because it was new to me
Hmm.
when you and I first talked, if and it might be for some of our listeners,
Yeah,
and so
absolutely.
a little background.
Yeah. So let me tell you first that the sort of primary practice of community building happens in what we call circle practice.
Hmm.
And so if I were to tell you the history of circle practice goes back, we can certainly trace it as far back as
Yeah.
um, fire,
Right.
right? So,
Yep.
so when humans
Sure.
figured out how to create a fire, what did they do?
Mm.
They sat around that fire and they told stories. And
Right.
they figured out
Communed.
how to be in family and community together around
Right.
that fire.
Hmm.
Now, over the centuries and millennia since then, um, many of the practices of the restorative justice movement are informed, in fact, by indigenous communities and indigenous practices.
Hmm. Yeah.
Um, and it's really important, of course, for us to acknowledge that and to talk about the ways in which we are using these practices to build peace and to infuse equity.
Yeah.
Um, in terms of the history of the restorative justice and restorative practices movement in the United States, that can be traced back to about the 1970s. And it comes from sort of a couple of different sort of foci. Um, a lot of this work comes out of both Quaker and Mennonite faith traditions.
Hmm.
Both of those are Christian practices where peacemaking is at the center of their practice. And so a lot of the sort of scholars of restorative justice are Mennonite and Quaker scholars also. Infused then into the criminal justice system, this has been work that has really worked, especially in juvenile justice
Hmm.
and some other particular sort of areas to look at ways to divert people from the traditional criminal justice system and create opportunities for collaboration and healing between victim and offender.
Yeah.
That, based on the literature, shows really important impact that
Mm.
people who have been the victims of crime have really actually experienced a much deeper level of healing than just the sort of
Interesting.
you know retribution of knowing that someone has been locked away and punished for their
Right.
crime.
Right. That's
But
really
actually,
interesting.
when we
Hmm.
enter into these human relationships and can experience
Yeah,
healing, it's a completely different picture.
absolutely.
Yeah.
I love that.
So then just the next sort of iteration is in terms of infusing it into organizations. And one of the places that it's
Hmm.
taken pretty decent hold is in higher education. We're
Yeah.
seeing it especially on campuses where there's like residential life. A lot of like residential halls will use it for conflict resolution and community building
Hmm.
within those sort of communal living spaces.
Right.
But then also having it used, for example, with judicial board processes or honor boards, depending on what the institution calls that. But looking at,
Right.
what are our institutional values? What are the ethical codes that we're using? And how do we use a restorative lens to come to issues of, violating those codes and working to make opportunities for learning rather than just simply punishment.
Right.
Mhm.
Right. I that actually helps, explain some when you look at how it's developed and where a lot of these principles and practices are coming from. It helps to understand its importance, which
Mhm.
is my next question, because I think it may seem sort of obvious
Mhm.
why it's important,
Sure.
but why is it important? And you've talked about the educational system,
Mhm.
but why is it important in nursing in general? And we have a lot of practice side
Mhm.
uh, uh, listeners
Yeah.
who are on the practice side. Why is it important in nursing? Why is it important in nursing, even in practice?
Mhm. Yeah, absolutely. So, so the way that I would answer that is very much in terms of my own story in nursing, which is
Mm,
that I feel connected to nursing as a profession because of the way in which we are so deeply committed to whole patient care.
right. Yep.
And I think one of the places that I want to really see restorative practices make a difference is that as nurses, we are so patient centered that sometimes we don't put enough importance or attention to our relationship with one another. And so I love to think about restorative practices as a way to strengthen the team,
Yeah.
and to build sort of a community of trust and a community of accountability within the team. And that's nursing specific, but it's all professionals specific, right?
Yes.
um,
You're right.
that the interprofessional team as a community is different than the interprofessional team where we're all so, nose deep in
Hmm.
exactly our scope of practice and what
Right.
is our responsibility, that neither are we fully caring for the team, nor are we fully appreciating and understanding the wholeness of the person that we are treating.
Interesting. Yeah.
So that's sort of my first answer.
Okay.
Um, my second answer, which I hope will be slightly more specific, is that I think we can all agree that our healthcare system is, if not broken, at least in need of quite a lot of reformation.
Sure. I
And
can see that.
I think that the lens of restorative practices, which brings along with it this lens of community and the lens of accountability
Hmm.
and the lens of equity,
Hmm.
which may challenge hierarchy, um,
Yep.
that there are some really unique and positive sort of perspectives that restorative approaches can bring to the healing that I think we need in the healthcare system.
Right.
And so to be able to think about any number of issues in healthcare through a restorative lens, I think would be great. So we're thinking about social determinants of health, health equity, access to care, access
Mm,
to, resources if care becomes either too expensive or family members are not able to sustain the sorts of accompaniment that are needed. Um, so to think about like how are we setting up a healthcare system that can actually meet the needs of our patients and the communities that we serve,
right.
and
Yeah.
how do we as nurses, the linchpin of the team, right?
Hmm.
Often the coordinators of all of this mayhem, as it were.
Right. Yes. Uh-huh.
How do we think about both wrapping the team around that community, but then also sort of rethinking how we're doing these systems, the system uh, of a hospital
Hmm.
and then outpatient, or the systems where we're discharging, but there's not a huge amount of follow up, right? So,
Right.
so how
Hmm.
are we thinking about all of this when out of one side of our mouth, we're talking about holistic patient centered care. Um,
Right.
but we're doing healthcare then in a hospital that patients leave, and there's not a communal sort of continuity checkpoint,
Right. That's right.
right?
Yeah.
So
Which happens. Absolutely.
absolutely. And we're driven then by all of these outcome measures that may
Hmm.
or may not really be helpful. Like meeting those outcomes doesn't necessarily mean that we're actually providing the best care for the community that we serve.
Yeah. I love this because this requires looking at the whole from the beginning and being very creative and innovative in the structure of systems. When you're looking at it through
Hmm.
that particular lens, you have to start from the beginning, right?
Absolutely.
And even when you're talking patient care, you're talking from the minute they, you know, start wherever they start,
Right.
right? And how they have access to care and where they're coming
Right.
from. And yeah, I love that's it's challenging. It's an amazing
Hmm.
challenge. So I think it would be important for us to talk about like the practicalities of
Hmm.
this. Like what is it? So and I've said we have practice listeners. We also have faculty listening as
Hmm.
well, which you are. And can you help us know what it really looks like practically, it maybe in a practice
Hmm.
setting? We know like you are building these restorative, what were they called again? Your students are champions for
Yeah.
this.
Restorative
Yeah,
practice student leaders.
student leaders,
Yeah.
absolutely, and they would be kind of championing this
Yeah.
in the practice setting.
Yeah.
What would this practically look like for our practice
Yeah,
listeners?
so let me tell you a story that is not my own, but a story from a colleague.
Okay.
So I have a friend who works in restorative practices, very, very new friend in my life, who works in
Hmm.
restorative practices at Tufts University. And he was on a panel discussion that I was facilitating a few weeks back for an elective that we're actually teaching on restorative justice in healthcare. And so David was sharing about some restorative circles that they put together at a hospital. It was actually hosted in the hospital space
Okay.
in a community in Boston where there was just a huge amount of distrust in the community for the medical establishment.
Hmm.
And we, of course, know that there are so many reasons for there to be mistrust
Yeah.
among particularly marginalized communities.
Right.
And so in this series of circles, they brought together members of the community from all different age groups,
Yeah.
different positions in the community,
Hmm.
and then members of the healthcare team, members of the healthcare administration, and they
Yeah.
sat in
Wow.
circle together. And one of the things that's really just sort of happens organically in circle is it helps us to shed some of our titles and
Yeah.
self-importance,
Hmm.
and
Hmm.
just be deeply human with one another.
Right.
And over a period of time, what David was saying was that as human beings got to know each other on that human level, trust began to be built in a completely new
Mm.
way,
Hmm.
so that folks in the community where this hospital was became more willing to seek care there.
Interesting. Wow.
And as you can imagine, when people began seeking care, healthcare outcomes began to improve.
I'm sure.
And so that is, I think, just a really excellent example of the ways in which some of these
Yeah.
practices can be used, where you don't need a big grant.
Right.
You don't need a whole program to be created. You just
Hmm.
need a few folks who are willing to give some time to pull some folks together and have some deep conversations in which we
Right.
learn from one another and learn how to adapt our healthcare spaces and our healthcare
Hmm.
practices to adequately serve and be accessible to the communities where we are stationed.
Yeah.
Um, so yeah, that's one example. I'd say another example, and this I think
Yeah.
really relates to sort of what we're doing on the education side, is that I think, in nursing education, one of the things we have to really be thinking about is that some of the problems that we experience in healthcare related to bullying and
Mm.
violence
Hmm.
and exclusion start in nursing school. And so,
You're talking nurse to nurse
mhm,
ish, like issues that come up.
right.
Yep.
So
Yes.
one of my
Yes.
least favorite phrases in the entire world is nurses eat their young.
Yes. Mine too.
Right?
Ah,
So,
me too.
so
Hmm.
where do we start countering that? Well, we have to
Right.
start in nursing school, because first
Hmm.
we have to create an environment where nursing faculty and senior nursing students are not eating or in whatever way abusing our
Right.
first semester students.
Right.
And
100%.
then it has to not just be about not abusing. It has to be
Right.
about creating a community where in our brokenness, we can become whole. And
Yes.
then it's out of that wholeness that we can be really good nurses. Right.
Right.
And part of that skill set is then also having the ability to say, I see nurses eating their young in the clinical setting, and
Mm-hmm.
I'm going to raise some questions about that. And
Right.
I
Yeah.
have the wherewithal as a young nurse to be able to do that. I have the skills, I have the mentorship and support that I need to be able to at least raise a question, if not intervene in the moment.
Yeah.
Right. So,
And
so starting that culture change on day one of nursing school is kind of what my agenda is.
yeah.
Um, and so what we're doing at the School of Nursing is that across our entry level programs. We've done this now in the BSN program, and we're starting now in our master's nursing entry to practice program, is to build these practices across the curriculum. So students are being exposed to restorative circles, right, in their courses, because it's a way not just to have a conversation where we're sharing our personal lives, but it's also a way to deeply explore content.
Right.
And so we're using this methodology to explore content and to explore the skills and attributes necessary to have deep emotional intelligence, to develop advocacy skills, and all the things we want our new grad nurses to have, right?
Yeah. Yes,
And
absolutely.
so teaching by doing, right? That then, what we're hoping is that our students, whether they're involved in taking the restorative practices elective or they become restorative practice student leaders, at least everyone has touched it a few times before they go into practice. And then we'll have some of these super users who are trained as facilitators, who will be entering practice able to facilitate a circle or able to facilitate a harm conference or some of the more specific harm related interventions, to offer this very different way of interrupting harm and then addressing harm when it does happen.
Yeah. That example, I think, is one of the reasons. That's where we overlap. I mean, we overlap, but there's so many reasons why this is important, and so many reasons why we at the MNRC, the Maryland Nurse Residency Collaborative, are so interested in this, is because that second example that you just provided is one of the reasons we do what we're doing, because of that, years of young nurses leaving the profession because of many reasons, but bullying being one of them. And so being able to address, give them mechanisms to navigate that, it right in day one of nursing school is so critical to us. And that's a huge part of our having our academic partners in such close collaboration with us here in Maryland, as we can talk about those things and what are we providing for our students, in order that when they come out and are graduated and are now practicing nurses independent, how are they coping? How are they able to navigate the very complex world of healthcare? So thank you for the work that you're doing. And I, this today was a small snippet, I think, of how deep this work goes, and how many, I think you and I could talk all day about the many restorative practices that there are and how we can use them and make use of them. So I hope our listeners do some deeper investigation into this. But I want to give you a big thank you. Thanks to Dr. Hannah Murphy-Buck for joining us today. And thank you all for tuning in to the MNRC Connection. You can learn more about the Maryland Nurse Residency Collaborative by visiting mdonl.nursingnetwork.com and clicking on the Maryland Nurse Residency Collaborative tab. Also, if you like what you hear, please be sure to give us 5 stars and be sure to subscribe to and follow the MNRC Connection. Share us with your friends and colleagues. And this season, we've added a feedback link in the description. You can tell us a little bit about what you think of our podcast by clicking on that link in the description and completing a very short survey. But until next time, stay connected.